This is going to show you corruption by your government. This is the Comprehensive Addiction Resources Emergency Act of 2019, sponsored by Elizabeth Warren, and it shows you why she is corrupt. This is going to be financial corruption. It's going to be obvious. Okay, so it says Comprehensive Addiction Resources Emergency Act. First of all, it's not comprehensive. Second of all, it's not an emergency. This is about the opioid epidemic. That is not comprehensive. Comprehensive addiction is more than opioid. Why is she only singling out the opioid epidemic? So this is misleading. Second of all, Emergency Act. This is an act providing funds for a period of 10 years. Does that sound like something you do in an emergency? You don't do an emergency act spread out over 10 years. You do it immediately. If it's an emergency, provide everything now. How much do you think the U.S. government of your taxpayer money should be made available for the opioid epidemic? $100, $1,000, $1 million, $1 billion, $27 billion, $27 billion, $27 billion. This bill that Elizabeth Warren is spending is $27 billion for the opioid epidemic. Now, it doesn't say it's to help people who have the opioid epidemic. It says areas affected by the opioid epidemic. This has got to be the biggest nonsense I have ever heard. What is an area affected by the opioid epidemic? Is this like a disease? I thought it was an addiction. Can't you live anywhere? What doesn't mean the entirety of the United States? Why does it say area, local? Okay, so she's saying states, territories, tribal nations, and local areas. Emergency assistance for the opioid epidemic. $27 billion. Where is that money going to? I bet you it's going to someone that in some way benefits her. So we're going to get to the 27. Here it is. The authorization of appropriations. This is $2.7 billion per year between the years of 2020 and 2029. I really don't think it's necessary. Here we've got more. There's a minimal allotment. So each state gets like 2 million minimum, 500,000, etc. Now, who gets the money? The number of drug overdose deaths. So I'm guessing that it's determined based on the number of drug overdoses. Who gets the money? Is it going to the state? Because isn't that what it says? This is very long and I didn't read the whole thing, but it says here assistance to states. It doesn't say to hospitals. So we don't know who's getting this money. But I really don't think that with the fact that we have $24 trillion in debt, that we should be spending $27 billion to just give money to a state because it has a certain number. See, it says affected by, these are areas affected by the opioid epidemic. So they don't necessarily have to be a person who has the opioid epidemic. As we saw down below, where it was talking about the 500,000, it is, it says that, where does it say, here's the formula, that the factor was based on the number of drug overdoses. But I don't think it is specific for opioid. So she's just giving money to all the states, and it's from this $27 billion based on how many drug overdoses are in each state. That's what this bill is doing. Now, you could argue that this is helping people, but don't they already have funding for this stuff? Aren't people already being treated? Oh, it looks like there's even more money. Here's $500 million I guess this is for the Native Education and Training Center. And we've got money for Indian tribes. This is $50 million per year for the Indian tribes. Grants to Indian tribes. Let's see what else we got here. We got grants for workers. I really don't think that this is well thought out. All she's doing is saying, let's take $27 billion and give it to everybody based on drug use. What about cancer? What about people who break their leg? What about people who have automobile accidents? Why is it that drug overdose gets $27 billion spent on it? Why is it that the states can't pay for it themselves? They got their own tax system. Why aren't they self-paying for it? What problem is she solving? It's not solving the opioid crisis because this isn't going towards opioid. It's substance use disorder treatment under the Medicaid program. Yeah, she's probably got donors who are in the healthcare industry. They know that people don't have the money to pay for it, so they want the government to pay for it. And this is how you redirect money to your campaign contributors. It's not going to people, it's going to the campaign contributors. This money is going to be spent somehow on disorder treatment. A disorder treatment provider is a hospital. That's what it is. They're redirecting money to hospitals. Same thing with the Affordable Health Care Act was. Redirecting money to hospitals, making it so that everybody's paying for health insurance, for health care, all that money is going to the hospital. Because people were going to the hospital and didn't have money and weren't paying their bills. That's why they created the Affordable Health Care Act. It wasn't to save you money or give you free health insurance. It was to make profit for hospitals. So this is just a weird bill that doesn't make sense. Why can't they do addiction resources for free? I mean, what are they paying for? If you overdose on drugs, what are they going to give you that they have to pay for? Are they going to give you a drug to deal with your drug addiction? Usually what they do is they lock you up in a room until you're over the drug. That's what the money's going to go for, apparently. Take the drugs away from people if they're overdosing on it. What is an overdose? Is an overdose when you die from... Okay, I guess that is what it is. But I don't know. I just think that this is a poor use of government funds, considering the fact that we have such a high national debt and we've got bigger problems.